Although the healthcare industry is probably more complex and patients are more idiosyncratic than aircraft, ships or power stations, they share a critical similarity in that they all rely on effective multi-professional teamwork and effective communication in stressful, fluctuating environments. Medical practice is particularly challenging because critical decisions are often made with incomplete evidence. In the aviation industry, where human error can have devastating effects, the goal was to embed the principles of effective teamwork into all flight and general operational training. These new, softer skills were deemed to be as important as technical skills and were to be taught to all personnel who were part of the operational division of an airline. This became known as the Crew Resource Management Project. A system for doing this training was developed and called NOTEX, or Non-Technical Skills.
NOTEX came out of the need to, if you're going to assess flight crew on their non-technical skills, which is what NOTEX means, non-technical skills, of course, you need some kind of objective structure. Obviously, it has to be research-based, and that's what it was. So originally, the American team, funded by NASA under Bob Helmreich, had their own NASA team skills, and we used to use those. But that was while we were just training. When you're now going to assess people in the airline industry, you're in effectively a pass-fail situation on your behavioral skills, not just on your technical skills. So to make it reliable, to make it objective, to stop it being an individual's feedback, then you need a structure. And it's quite easy to do. If, for instance, if you look at one of the facets of leadership, it would be introducing each other by name and role for a kickoff. You can tell whether somebody does that. So it's no longer your opinion of, oh, that was rubbish leadership, this is good leadership. So a good leader would be a good role model, but you can break it down into specific objective behaviors, which you can associate with effective teamwork and with ineffective. Now, if you go further in the aviation industry and beyond, NOTEX have come to be two social skills, which revolve particularly around leadership and management and cooperation, all embedded with communication throughout, and two cognitive functions, which are situation awareness, which is what it says, the mental model really that we have of what is happening now and how that compares with what we expect to happen. And on that, of course, is your decision-making. And decision-making skills, again, are quite specific. And the two of those are called the cognitive skills. So you have social skills, cognitive skills, and then broken down into elements and then observable, objective behaviors that go with them.
The behavioral marker system used by NOTEX describes human interactions in four main categories. Two cognitive categories, situation awareness and decision making, and two social categories, leadership and team working. The NOTEX category of teamwork is called communication and cooperation. It is divided into four elements, each of which has observable and teachable behaviours, both positive and negative. Using this system, an experienced observer can pinpoint which elements of teamwork are effective or ineffective. Those same behaviours can then be observed and used in training. Using the system, an observer can pinpoint which elements of teamwork are effective or ineffective. Behaviours can be observed and training given to contribute to a more effective team performance. An experienced coach should be able to use this framework to identify areas where teams need assistance and also to show teams how they are performing in an effective manner. The NOTEX system has been adapted for use in various studies within healthcare. While the NOTEX system is a great help in assessing teamwork skills, it is short-term and limited in its scope. A number of significant issues are missing, such as motivation, skill development, skill deployment, time use, and process improvement. These omissions reflect the origin and nature of the system, in that it was used by independent observers of flight deck behaviour among airline crew over a period of a few hours. Healthcare training in human factors, in general, and teamwork in particular, currently involves offering training to self-selected groups of employees who have a specific interest in the subject. We believe that for the best results, it should be given to all healthcare staff to whom it is relevant. No-tech systems can be an important part of the bridge between these two modes of training. They can be a useful aid in helping the self-selected group become the trainers for other staff members. In fact, this is how no-tech started in the field of aviation.